Hello everyone, welcome to my YouTube channel. In this video, we'll be going to discuss about the shoulder joint. So shoulder joint is actually a very important joint in our body because it is the most movable joint in our whole body. And so it becomes the least stable joint in our body, right? And it is very common joint to undergo dislocation. So we're going to discuss about the shoulder joint in detail about its anatomy. So, what is the type of the shoulder joint? The shoulder joint is actually a ball and socket type of synovial joint, right? So, ball is actually the head of the humerus and the socket is the glenoid cavity of the scapula, right? Now, we are going to see about the articular surfaces in detail. So coming to the articular surfaces, the shoulder joint is actually round. The head of the humerus, right, is formed by the head of the humerus and the glenoid cavity of the scapula, right? Now, the head of the humerus is joined with a relatively shallow glenoid cavity, but it is very effectively deepened by a fibrocartilaginous ring called glenoid labrum. So it is a fibrocartilaginous ring which is actually present around the glenoid cavity, which deepens the glenoid cavity and increases its efficiency. So now we are going to discuss about a very important thing, that is the ligaments of the shoulder joint. So please note guys that the shoulder joint is actually a very important question for the university exams for the first year. So it is very important to study the ligaments. So ligaments of the shoulder joint, first ligament we are going to see about is the capsular ligament. So definitely when you see capsular ligament, it means it just encapsulates the capsule of the shoulder joint. So the capsular ligaments around the glenohumeral joint, that is the whole shoulder joint, it is related medially, or it is attached medially to the circumference of the glenoid cavity beyond the glenoid labrum or glenoid ligament, and also laterally it is actually attached to the anatomical neck of the humerus. So next one we are going to see is about the synovial membrane of this joint. So definitely it is I told you earlier, that is the ball and socket type of synovial joint. So definitely if we say synovial joint, it means that it has a synovial membrane inner side of the capsule. So this synovial membrane is actually a very important feature of this whole joint, and there are different openings present in this synovial joint also. That is, there is primarily three openings. So one opening is that the opening between the two tubercle of the humerus. You can see here the two tubercle of the humerus. I'm just going to show you. So this is a two tubercle of the greater and the lesser tubercle of the humerus, and there is again a aperture or a canal between these tubercles, which actually forms a passage for the tendon of biceps, and this is one aperture. So the next aperture is actually situated antero-inferior to the coracoid process. So coracoid process is actually here. It is situated antero-inferior to the coracoid process. Next opening is actually present between the synovial cavity and the infraspinatus bursa. So it is not actually seen in this picture. Now, next ligament we are going to discuss is about the glenohumeral ligament. So from the name itself we can say the attachment, glenohumeral ligaments. So definitely it is in the anterior aspect of this glenoid capsule, and it is actually having a three fibrous band. So these bands are actually divided like superior band, middle band and inferior band. So the superior superior band is actually attached to the upper end of the lesser tubercle, middle band attached to the lower part of the lesser tubercle, inferior band to the lower part of the anatomical neck of humerus. Now, this bands are very important, especially the superior and the middle glenohumeral ligament. It is very important to prevent the shoulder joint from anterior dislocation, because these bands are present in the anterior aspect of the shoulder joint, so it prevents the shoulder from anterior dislocation. Now, next ligament we're going to see is also very important, that is a coracohumeral ligament. So coracohumeral ligament is actually a strong band of fibrous tissue. So the attachment is actually in its name itself, right? So from the coracoid process to the greater tubercle of the humerus. So that is its attachment. So from the base, so in detail if I have to tell you, that is from the base of the coracoid process to the anterior aspect of the greater tubercle of the humerus. So you can see this, it's not that clear, but this is actually the coracohumeral ligament. So this is a coracoid process from the base of the coracoid process to the greater tubercle of the humerus. So that is the coracohumeral ligament. So next ligament is actually the transverse humeral ligament. So from the name itself, it is very clear that the transverse humeral ligament is a transverse ligament which actually extends from the greater tubercle to the lesser tubercle of the humerus. So as you can see in this picture, this is a greater tubercle, this is a lesser tubercle, and this is actually the transverse humeral ligament. Here it is given just transverse ligament, but it means the transverse humeral ligament. This ligament actually converts a bicipital groove of the humerus between the two greater and the lesser tubercle into a canal which allows a passage for the biceps tendon. So that is the difference of these peculiarity of the transverse humeral ligament. Now we're going to see about the accessory ligaments of this joint. So there are three accessory ligaments. So one is coracoacromial ligament. So here you can see the coracoacromial ligament. This is a coracoacromial ligament. So from the name itself you can understand that from the coracoid process to the acromion process is a coracoacromial ligament. So it is present in the superior aspect of the whole joint. So this is a joint, but it is present in the superior. So it actually prevents the humerus from superior dislocation. So that is the importance of this coracoacromial ligament. So this coracoacromial ligament, along with the coracoid process and acromion process, it actually forms like an arch. So arch above the whole glenohumeral joint, that is a shoulder joint, forms an arch, and this arch is actually called as coracoacromial arch, right? And this arch is actually very important because below this arch only you can actually see, this picture is very clear, this is actually the arch. So below this arch only you can see the supraspinatus muscle is actually present, which actually comes and joins with the joint capsule. So this is a joint capsule. The tendon of the supraspinatus comes and joins to the joint capsule below this arch, and there is bursa below this arch. That bursa means a space, right? So that space or that bursa is actually called a subacromial bursa. The next thing we are going to see is actually about the bursa of this joint. So there are three bursa, two main bursa and another one bursa. So the three bursa are the subscapular bursa, subacromial bursa, and infraspinatus bursa. So first bursa what I'm going to talk is about the subscapular bursa. So as you can see, this green part which is actually given is actually the subscapular bursa. So the subscapular bursa is actually between the tendon of the subscapularis muscle. This is the subscapularis muscle and the neck of the scapula. So it is between this. It's called a subscapular bursa. So mainly these bursa are actually present in our body to prevent the friction between the tendon of the muscle, and also the friction between the bone and the muscle. So for all these things only this bursa is present. So definitely this bursa is also helping friction against the joint. Now next bursa we are going to see is the subacromial bursa, which is very important bursa. You can see, so subacromial bursa means definitely is below the acromion, right? So this is the acromial process. So below that only you can see the subacromial bursa. So below acromion process and the coracoacromial ligament. So this is the coracoacromial ligament lies the subacromial bursa. So this bursa is also called as subdeltoid bursa. Why it is also called a subdeltoid bursa? Because above all these structures only the deltoid muscle is located. So deltoid muscle is actually located above all these structures. So primarily you can see this bursa is below the deltoid muscle. So it is also called as subdeltoid bursa. And below this bursa only you can see the supraspinatus muscle is also located. Okay, so that is about this bursa. And one more bursa, that is infraspinatus bursa, which is not actually seen in this picture. It has actually seen from the posterolateral aspect of the joint, and it is between the tendon of the infraspinatus and the joint capsule. So that's all for this video, guys. If you like this video, please like, share and subscribe, and also please hit that bell icon. Thank you, guys. And there is again a part 2 video of shoulder joint where I'll be discussing about the relations about the arterial supply, nerve supply, about the movement stability of the shoulder joint. So please don't miss to check out that video. Thank you, guys. Bye.